I'm Dr. Mike Milligan. I'm here with Dr. Joseph O'Giles of St. Louis, Missouri, physician, sleep specialist. Joseph, thanks so much for being with us.
Thank you. It's great being here.
Now, you do a number of things with sleep, with the hospitals and all. Tell us a little bit, and teaching. Tell us about all the things that you do.
Well, I'm actively involved in patient care on a daily basis.
Right.
We also are involved operating and delivering care both on the testing side and on the research and education side for both patients and fellow physicians and dentists.
Right.
So we've tried to have the whole continuum of sleep care in one organization, and that's been our goal.
Wonderful. Well, so typically you've got your sleep specialists and your CPAPs and your dental devices and your surgery. Tell us about this and what you feel about all of that.
For many years now, over 25 years, as the diagnostics and sleep apnea obstructive sleep apnea have gotten better, right. CPAP, or continuous positive area pressure, and its derivatives have been the main modality of therapy. And they remain the main modality of therapy with some variation. What we've seen in the last 5 years or so is that oral appliance therapy has improved, the technologies have improved with the plastics, better delivery devices, and actually dentists are getting more interested in delivering the care. So it's actually expanded our ability to help patients. Mm-hmm. We're collaborating and integrating more with dental professionals who've decided to have expanded expertise in sleep medicine.
Right.
And sleep touches almost every other aspect of health, especially obstructive sleep apnea. Right. So it's one more way that both physicians and dentists can improve overall health, both health delivery and health outcomes. Right. As a few examples, you've got blood pressure control, heart disease, diabetes, and weight control, just to name a few things that can be positively impacted.
Sure. If you're not getting your oxygen, it affects everything, everywhere the blood goes in your body.
It sure does.
So.
And the other aspect of that is to focus on the health aspects, which generally dentists have been more focused in this area with preventive dentistry.
Oh, sure. Wellness and prevention.
So one of our passions and missions is to say that good sleep health should be a fundamental part of your healthcare plan, meaning diet, exercise, and sleep health. Right. Getting enough sleep, making sure there's no other sleep disorder, but integrating healthy sleep patterns into your daily routine. In the past, it is critical. It affects every aspect of life, from your relationships to behavior, to your sense of well-being and disease. But also, sleep's been the one thing that is easy, if you get busy, to get rid of. Right. And what we'd like to is to start to have a dialogue with patients, and frequently our dental colleagues have the ability to do this, to say, maybe what you have to do is make some life choices, but don't just automatically sleep less and get all the ramifications of that on the negative side.
Absolutely right. So how do you see the dental, working with a dentist, okay? Some dentists might be intimidated or wonder how to visit with their sleep docs.
First of all, I would encourage open communication, and that needs to go both ways. Mm-hmm. We've tried to reach out to colleagues in our area that are interested in sleep medicine, is whether they just want an educational experience or they want to start integrating it as part of their practice. Mm-hmm. The other side of that is, what we've seen from the outcome standpoint is the dentists that have been more interested in understanding and working on the physiology and collaborating, we give them a good firm diagnosis based on history and diagnostics. And then in turn, the dentist does the proper dental care for the appliance. We don't meddle in that or try to tell the patient, the dentist, what to do, but then we want to measure the outcome.
Sure.
And what we found is that back and forth has allowed a seamless experience for the patients and exceptional outcomes for patients. To ultimately, they can discard some of their physicians. One of the things we tell patients is, if this all works, when we're done, you won't have to see us anymore. And humbly, that's a very satisfying thing for patients.
Absolutely. If we can help the patient, that's what it's all about.
Sure, it is. And it's really satisfying.
Let me ask you, how do you feel about home sleep tests just to screen? We see thousands of patients every 6 months in a dental office. there's a huge population out there that has no idea that they have sleep apnea, and many people who you wouldn't even expect to have sleep apnea have it. How do you feel about dentist screening with the home sleep devices?
I'm very comfortable with home sleep testing. We do a significant amount of home sleep testing. Mm-hmm. I think the key there is collaboration. Absolutely. If the dentist is working or consulting with a sleep physician, integrating that and having the dentist do primary screening, mm-hmm. I think is very reasonable. Right. And I think you're going to find there's technologies coming that will allow even easier modalities of screening over time. I think they're going to be coming rather quickly, and it's an exciting development. If we can increase the rates of screening and impact outcomes with patients, that's what we need to do. This is a vast population which is still being underserved. Right,
right, and the dentist cannot diagnose, but we can screen, get them to the sleep doc, the primary care physician, to do the diagnosis, and then help in the treatment if that's appropriate.
Our view is that dentists are effectively become primary care providers. You're doing primary care on oral health, mm-hmm. and screening the patients, as you suggest, should be not only allowed, but should be encouraged.
Encouraged, wonderful. What else would you like to tell us from your aspect as you work with dentists or even patients? What should we as dentists know?
The main thing is that you have tremendous value. Dental professionals have tremendous value in diagnostics, mm-hmm. and therapeutics, mm-hmm. and the key is to be fully integrated. Because the percentage of patients that either will accept one modality or the other is not 100%. Right. So there are patients who think they might want to go with an appliance first and then discover through either evaluation, right. or economics that they're better off with a different modality. Sure. And that goes with also with positive airway pressure. Sometimes they initially believe that this is the way to go, but we want to make sure they know they have choices and opportunities, mm-hmm. to change their mind, mm-hmm. that they're allowed. Right. And we only can do that if we're working as a team with dentists versus working somehow either adversarially or in competition. Right. We don't view it that way.
That doesn't help anybody, especially the patient. So how would we get in touch? How would we learn more information? Do you have a website?
We do, ClaytonSleep.com. Okay. You can go there. We have resources for professionals there. You also can contact us through that website. We do education. We not infrequently have dentists who contact us or want to come and have a meeting and talk about how they could see that integration occurring. Wow. Sometimes it's just a casual conversation, mm-hmm. and we're fine with that. Okay. So we'd be happy to have that conversation and use the website. We have educational material up there. We have media up there, right. ways to contact us, and we have a professional meeting coming up in October, and we also love having dentists at that as well.
Wonderful. Well, Dr. Ojal, thank you so
much
for being with us.
Appreciate it, Dr. Milligan.